Okay guys, we are going to move to the 7th part of our polytrauma station, and in this part the examiner now will jump to something else. He will jump to the intrinsic and the extrinsic pathways. Okay, fine. So intrinsic or extrinsic pathways, intrinsic or extrinsic coagulative cascades, whatever it is intrinsic and extrinsic pathways. So it doesn't matter. He will ask you some questions about that. The questions in this topic here in the station about intrinsic and extrinsic pathways are about 3 questions. Okay, so the first question in this part about intrinsic and extrinsic pathways will be about activation. What will activate the intrinsic pathway and what will activate the extrinsic pathway? So for the intrinsic pathway, okay, the activation will be by visual injury. Actually, to be specific here, it is an endothelial visual injury. Okay, so the injury of the endothelium of the visual will activate the intrinsic pathway. Okay, so for the extrinsic pathway, how is it activated? And the extrinsic pathway is activated by it is usually due to the damage of the cells, and the damaged cells will release something called thromboplastin. Okay, and this thromboplastin will activate the extrinsic pathway. So to make this question easier for you and to remember it, so the intrinsic pathway is activated by the endothelial injury. So both of them are something internal, either intrinsic or endothelial visual injury. For the extrinsic pathway, so this occurs due to an external thing, damaged cell in the outside, which releases thromboplastin and causes the activation of the extrinsic pathway. Okay, so I hope that this point is clear. Okay, so one point you can add here in the intrinsic pathway activation, so the endothelial visual injury will activate factor 12. Okay, you know that there are 13 factors in the coagulative cascade, and the activation in the intrinsic pathway will be by endothelial visual injury, which will lead to the activation of factor 12. Okay, and from here it will run. Nobody will ask you tell us about the cascade, how many factors are there. Nobody will ask you that. It is just a general question, just to test your knowledge. This is the first question in this part of the station. Okay, the second question that will be asked to you is actually about the tests. How can you test the intrinsic pathway, and how can you test the extrinsic pathway and the common pathway? There is also a common pathway in coagulative process. This question can come in two ways, but I will show you both ways. Okay, so he may ask you what APTT tests, and the answer is it tests the intrinsic pathway. Okay, what PT tests, and the answer will be the extrinsic, okay, and the common pathways. Okay, so he may ask you, how do you test intrinsic pathway, and your answer should be APTT. Or he may ask you what APTT tests, and your answer will be the extrinsic pathway, and the same for the PT and extrinsic and common pathways. Okay, so in this way, this part of the station is finished. These are actually, he will ask you this as a separate question, and this will be as a separate question. Every one of these questions will have its marks, and this is good for you because these are easy questions. By this way, this part of the pathways will end here, and he will jump to another topic that is not related to this.